Hello, everyone. I am Monica Rivera-Margas, a licensed clinical social worker and the Assistant Coordinator of BOCES Employee Assistance Program. I am going to talk to you about coping with job stress and anxiety during the COVID-19 pandemic. COVID-19 impacted the way we operate in different areas of our life, changed our daily routine, limit our freedom to visit places, travel, and to socialize with other people. Increase the risk of conflicts in our relationships with friends and families, and increase our stress level due to financial and employment concerns. Keep in mind that stress is not that bad. Some stress can be the motivator to keep us safe and take all the precautions we need to avoid getting sick and the transmission of the virus. Some stress also help us to follow the rules to avoid trouble. It is normal to have some stress when you deal with life demands, job and financial responsibilities. It is important to limit the amount of time you spend talking about the current crisis or negative events with your friends and family to avoid overwhelming yourself and others. Overwhelming amounts of stress can affect our mental health and can be transmitted to others. It can affect our ability to manage life, our self-confidence, our relationship with people, and our problem-solving skills. If you are struggling with overwhelming amounts of stress, call the BOCES Employee Assistance Program at 631-289-0480. The EAP counselor will provide support and help you to identify your needs and customize a referral for you. All our services are confidential and free of charge. Now let's talk about the stress signs and symptoms. Cognitive symptoms, memory problems, inability to concentrate, poor judgment, seeing only the negative in every situation, anxious or racing thoughts, constant worry, emotional symptoms, moodiness, irritability or short temper, agitation, inability to relax, feeling overwhelmed, sense of loneliness and isolation, depression, or a general sense of unhappiness. Physical symptoms, aches and pains, gastrointestinal problems, nausea, dizziness, chest pain, rapid heartbeat, loss of sex drive, and frequent colds. When your stress level is high, your immune system gets low, so we are more at risk of getting sick or having an infection. Behavioral symptoms. Some people will find themselves eating all the time as a way of coping with their stress, and some people will have no appetite. Sleeping too much or too little, isolating yourself from others, procrastinating or neglecting responsibilities, use of alcohol, cigarettes, or illegal drugs to relax, and nervous habits. Coping with your stress about work. Assess your feelings and thoughts about being at work. If you feel fearful or concerned about it, ask yourself what you can do to feel calm. Maybe practicing 5 minutes meditation in your car before you go to your building will help you to feel grounded and focus. Maybe practicing positive affirmations when you get ready to go to work might help you to feel more relaxed and help you to feel more hopeful. Identify the positive aspects of working in your building. For example, having some sense of normality in your daily routine and also social connection. Implement the strategies that will help you to manage your anxiety, such as taking a bathroom break or go out of your building for a few minutes to get fresh air without the mask on. Keep hand sanitizer handy and an extra face covering in your possession just in case your face mask is sweating or moist. And it's extremely important that every time you have a negative thought, that you challenge yourself to identify if those negative thoughts are rational or irrational. You have to ask yourself if you have any evidence to believe that the thoughts that you're having in your mind are accurate or inaccurate. If you identify that the thoughts that you are having are irrational, reframe them and replace them for thoughts that are more hopeful or that leave some room for a positive outcome. Be patient with yourself and others. Avoid judgment. Engage in self-care to release stress. Find opportunities to have fun to balance your day. Find a safe way to socialize with others. Socialization is a great tool to distract yourself from all the problems that you're having in that moment, and also to have some sense of connection with the outside world. Dealing with others at work. Keep positive about the quality of interaction you will have with most of your coworkers and students. Keep cool when you are dealing with someone who seems to be distressed and frustrated. Don't take it personally. Many times, their behavior and reactions have nothing to do with what you are doing or what you're saying to them. Practice verbal and non-verbal de-escalation techniques, such as soothing the tone of your voice, pleasant body language, good listening, and validation. Validation doesn't mean that you are in agreement with what the person is saying. Validation is an understanding that the situation is causing this person to have strong emotions and uncomfortable feelings. Normalize and validate your students' concerns and fears. It is important to talk to your students openly about their concerns and their fears, to help them to understand that it's normal to feel that way under the circumstances that we are all living in. Avoid judgment and resentment. Everyone is dealing and processing the pandemic in their own way. Maintain open communication with your administrators and provide ideas and concerns to improve the work atmosphere. The COVID-19 pandemic is something new for all of us. It is important to be flexible and supportive with each other and understand that sometimes the policies and procedures will have to be adjusted or changed because they might not be working in the way that it was expected. Flexibility from administrators all the way down to the staff is necessary for positive outcomes. The most important is to understand that it's normal to have a reaction to drastic changes. However, as human beings, we have the capacity to adapt to changes. Once that we get used to these changes, and these changes become our new normal, we will feel more calm and relief. Give yourself time to adapt and keep hope that you will be able to manage these obstacles. Thank you. I hope that you enjoyed this presentation. Now, I want to invite you to participate in a 5 minutes guided meditation with me. Please sit back and relax. Take a slow, deep breath and close your eyes. Allow your eyes to be closed and remain closed during this session. Breathe. Every time you exhale, imagine that you are removing from your body all the stress, all the tension that your mind and your body do not need. And every time you inhale, imagine that this flow of air and relaxation is traveling all over your body as a medicine that will help your brain and your body to heal and recover. Breathe and exhale. Now focus your attention on your feelings, any feeling that you might be experiencing right now. If you're having a negative feeling, don't judge it, don't criticize it. Just imagine that you're holding this negative feeling between your hands and you're putting this negative feeling right next to you. Not close to your body, not all over your body, just right next to you. And you're going to tell this feeling, I know that you're here. I know that you are with me today, but I have to let you go. You cannot be with me 24/7. I have to let you go. If you are having a positive feeling, imagine that you are holding between your hands this wonderful feeling and you are pouring this wonderful feeling all over your body, allowing each cell of your body to absorb this feeling. Enjoy the moment. Now, you will focus your attention in what your senses can perceive right now. Let's focus on your sense of hearing. Identify every tiny sound that you can detect right now. Now, focus your attention on your sense of smell. Recognize every smell or perfume that you can detect right now. And breathe. You are going to use your sense of sight to remember all the things that are around you. All the colors, all the objects, everything that is around you right now. The different items, the different objects that you saw before I ask you to close your eyes. Now, you are going to use your sense of touch to identify how your hands are feeling at this moment. Are your hands feeling sweating? Are they dry? Are your hands feeling soft or feeling rough? Are your hands feeling cold or feeling warm? Just focus your attention in how your hands are feeling right now. And take a slow, deep breath. You are using all your senses to ground yourself to the present moment. Allow your mind and your body to connect and listen to the following message. You are special. You deserve to be calm, to be relaxed. You have all the tools that you need to solve many of the problems you face in your life. You have all the skills that you need to adapt new behaviors and unlearn unhealthy ones. You are smart. You are a good person. You have the inner ability to heal yourself from any emotional or physical pain you might be experiencing right now. Believe in your inner power to create positive changes in your life. Every day, in every way, you are better and better. Believe. I am going to count from 1 to 3. When I reach to the number 3, you are going to open your eyes slowly, feeling good, feeling peaceful. 1, 2, and 3. Thank you, and I hope that you enjoy this meditation practice with me. Have a good day.